All right, welcome back to The Explainer. Tonight we're focusing on what's happening at the counties and at the national government, Ministry of Health, on the rights of UHC workers. I'd like us to get straight into the questions. There are hundreds of them, as many as we can get to. Governor Njuki, this one is to you. I'm a UHC worker. We're okay with being transferred to counties with our payslips showing our terms as permanent and pensionable from the data they share with the MOH. And also, try not to call, just text. We are live on air. I will get to the text messages as quickly as we can. But when you call, it disrupts our ability to be able to see the messages that you are sending. Here, first, can they pay the gratuity first for the first contract term? Maybe this is to you, PS, because that's where the money was coming from. The gratuity? Because it's supposed to come at the end of the contract period. Now, there was the end of one contract period and then an extension. So what they're asking for is a gratuity for the end of that contract period before the extension. So when a contract is extended, the contract has not ended. It has been extended. Mm-hmm. It has been varied. So the contract, and I think this has been a misinterpretation. So when you have a 3-year contract and then the contract is extended and then again extended, that contract is still alive. Okay. I hope that clarification is clear. And I think there's been the perception. So what happens is that if a contract ends, you're supposed to be terminated, and then a new contract is issued through another recruitment process, which is what would then make anyone eligible for gratuity right now. Yeah. Otherwise, the eligibility of a gratuity is only valid after May of 2026. Okay. So that discussion does not exist as at now. Okay. I'd like us to, we also received some questions. Let's get to some of those now to get to answer them. Here, the government has power to identify the said ghost workers. My question, is it a trick to delay UHC staff absorption into PNP? Now, before we even answer this question, Governor Njuki, let's understand. You said there's 3,000 ghost workers that are unaccounted for. Could you explain to us how you arrived at that number? Well, allow me to say, first and foremost, that is what we call figurative speech. The essence of this conversation is that the number of UHC workers we have on record and the ones that are actually on duty, they differ. And it will not be proper or right, even for one worker to be paid with taxpayers' money without working. And that is why it brings in the essence of reconciling these records that are with MOH and the ones we have for the people working on the ground to ensure that there is nobody who is getting pay and they have not worked for it. Okay, so Governor, I want us to now get on record. You said 3,000 workers. Are you now walking back that statement today that you did not mean that there are 3,000 ghost workers? I would wish to have a look at that clip where I said, because I said we have almost. Okay. All right? Almost, because in our counties at the moment in the hospitals, we have less than 5,000 of those 8,500 who are working at the moment. Some of them say they're on strike. Okay. Others left. Others got jobs somewhere else. And unless we reconcile these records with the ministry, we will not have these figures. And that is why Governor, in the meeting that we had with the CS... Allow me to interject here. Yes. Numbers are important. And facts and figures are important. You said 3,000 in that clip. Now you're saying it's almost 3,000. Do you not have the facts? I said... hang on one second. Yes. You are the chair of the Committee of Health at the Council of Governors. Why would you commit to such an exact figure if you are not sure? So what is it and where are you basing the numbers on? Could you just give us... hang on a second, PS. 1 second, PS. So Yvonne, you speak like a journalist in the media house. Yes, I am a journalist in the media house, and you are a governor. I used a figurative speech where I said almost 3,000, and I can justify that. Okay.
At the moment, less than 5,000 UHC workers are in our hospitals. And therefore, when I go to my hospitals in Tharaka-Nithi, and I just checked this morning, I have less than 100 that are working, despite the fact that I was given 223. The rest are not there. If I check with other counties, the same thing. Where are these workers?
Governor?
So if the workers are not in their station, they're being paid, then I can equate them to ghost.
Governor?
Yes.
For a man who is a CEO of a county,
yes.
For a man who today says he speaks on behalf of the Council of Governors,
correct.
Why would you be speaking figuratively, and why would you not come prepared with certain numbers? And this is why numbers are important. It is a payroll that we're taking a look at. It is how much you're paying each of these workers. So what is that number, and where are you basing it on? This is the reason I asked this question. Based on a letter that was written by the Ministry of Health, there is actual workers that are on site versus the payroll that comes from the national government. By that document, the discrepancy is about 238. Now, 238, Governor, is not the same as nearly 3,000. Now, surely in a matter that is dealing with people's lives, people's livelihoods, and the services that they provide, do you not have a figure which says, we have these ghost workers, this is the amount of money that we are losing, because that money is taxpayers' money, is it not? This is the amount of money we're losing, and we need to then get it right and perhaps weed out X number of ghost workers. Because as a CEO of a county, you cannot say you are speaking figuratively.
Yvonne, I am not taking back my words. I am simply saying that the arrangements that we have at the moment is not working out for accountability.
So so speaking of accountability,
yes.
How many
because
how many ghost workers, Governor?
That's the reason why you're going to do a head count to ascertain how many are in their working stations, how many are not in their working stations, yet they're getting paid. And there's a reason why we said we have to do that.
Okay. Yeah.
Because you can hear they're very interested in being paid from the national government or from the ministry, but they do not want the payroll to come to the counties, because they would rather be paid from the ministry, which does not account for their time on the ground.
So, Governor, why did you give a figure if you haven't done a head count? Where'd you get the figure 3,000 from?
I said it's almost 3,000 because I have given it very clear. I don't know why we keep on going back on this.
No, because numbers are important.
And I've given you my numbers, why the numbers are important in this particular case is because more than 3,000 workers at the moment as we sit here for UHC who are waiting for salary at the end of this month. They're not at their working station. So if they are expecting to be paid by the ministry and the ministry does not know that they are not at work, because if I asked the ministry today, would you know how many are in the hospitals at the moment as we speak?
He doesn't.
He doesn't know.
Okay, good.
He doesn't know.
And do you?
Personally, we have the figures.
Because I want to hear that number.
We have the figures who are not in their workplace at the moment.
How many are there?
And they are more than 3,000 who are not in their workstations.
So more than 3,000 are not in their workstations.
Yeah. And are they going to receive the salary at the end of this month? Of course, they're going to receive a salary using taxpayers' money. Where are they being paid, yet they are not working?
Okay. You explain to us, because there's a document that's from the Ministry of Health.
And for that reason, yes, I know.
Which, by the way...
On the 16th of May,
yes,
I signed a letter to the CEO of Council of Governors, and that letter was based on numbers we had received from the Council of Governors.
The Council of Governors that Governor Njuki sits in?
Yes. And
so these are the numbers that...
The numbers was, and I think if you want to dwell on the numbers, but I wanted really to clear with this issue first. Can I clear with this issue? Or
of the ghost workers?
I wanted to... Do you want me to clear the letter first or with the issue of the...
because it speaks to the issue of ghost workers.
So the letter
speak about the letter,
was very clear.
Yeah.
It was stating that those that we have in our payroll is 7637.
Yes.
Those that we have received from the counties is 75. Yes. 78,
yeah.
Which means that the counties submitted 238 more than we do have. But if you look at that figure, if you look at just around 3 or 4 counties, you look at Homa Bay, for example, you find that our figure is 0 and the county is 183. Okay?
Yeah.
Because there is an issue. So we do not have the Homa Bay in our payroll. but they are UHC workers in Homa Bay. If you look at, there are some few discrepancies in the counties. I think Marsabit, if you look at Nyeri, if you look at Wajir. So those are very easy to reconcile. And then from where we sit, we do not see a big deal because of three issues. One is that the counties write to us often that these workers we have a disciplinary issue with. And so sometimes you find that the county has already resolved the disciplinary issue, but the Ministry of Health stopped the salary. So it is possible that there is discrepancy because of the delay in the communication that the governor was talking about. For example, we had a letter from Kakamega telling us that these 4 workers, they got into an interview competitively and we absorbed them. And so you find that the county may still have submitted that data, but the Ministry of Health has already removed them from the payroll. So there are very many reasons to explain that discrepancy. And so it is, let me use the word, it is not very material right now in the resolution. What is very material is what Governor was mentioning, not necessarily the number that he mentioned, but the import or the significance of doing an audit and doing a head count. Because of what we want to do in terms of the decision that lies ahead, that decision of taking the resource and the payroll to the county, it is very important that we are on the same page, and we are on the same page with the county governments. And there is already an agreement between the Ministry of Health and the county governments in the second week of June that a joint team between the counties and the ministry, and of course we are going to involve the Office of the Auditor General, will go down in the counties to do a head count and also to do an audit of the numbers. So that
when do you think that's going to happen?
The second week of June.
Second week of June.
And what the governor was mentioning, we are completely in support of that from the Ministry of Health.
Let's take another question now and try and... all right. Kindly ask Dr. Ouma why he abandoned his divine call to agitate for welfare of healthcare workers. 1, why MOH considered UHC staff posted in national hospitals for PNP and left out UHC staff working in the county government. Number 2, why the MOH harmonized salaries of UHC medical officers but is yet to do so for over 17 other cadre employed under the same UHC program. P.S.
Thank you so much for this question. I think we are very keen to make sure that all health workers are treated equally, and I don't think that we have ever abandoned any call to advance the cause of health workers. As I've mentioned, we are very clear in terms of reconciling the contracts of these workers, and I think if they have a friend, then they have that friend in me in terms of understanding the issues, but there has to be processes, and that is very key to lay down here. There has to be processes that must be followed. For example, the fact that where your contract lies is where your pay should come from. I think that is something that is constitutional. It's beyond empathy and sympathy with the cause. What we are doing in the ministry and what we have already done is to engage with our National Assembly Health Committee. We have already engaged with the National Treasury to make a case for reconciling of these contracts and for resources that then can be used by the county governments. I wanted to read a list of the cadres that were in the UHC, and you will see that there was no doctor. I have that list here with me. I wanted to read the list of the cadres so that we also clear the perception that some groups of workers were so yeah, I have here the list. So it started with registered clinical officers, 500. Registered nurses, 2,000. Pharmaceutical technologists, 200. Enrolled nurses, 500. Medical laboratory technologists, 200. Community oral health workers, 100. Radiographer, 50. Assistant public health officer, 500. Community extension workers, 1,500. There was no single doctor that was employed on the contract of UHC. And there has been no single doctor whose contract has been confirmed in discriminating the other workers. I think it is very important that we stick on the path of truth as we agitate for what is right.
Okay, let's take another question. I believe this one is for the governor. Let's see that. Yeah, to Governor Muthoni. Yeah, why does he want the payroll to be transferred to counties before our transition? Could the governors also be planning to add their own also? This is the question that came up earlier. So essentially they're saying fix the terms first and then we can move.
Our position is very clear in this matter. As for our meeting on 19th of May as the Council of Governors, we have made it clear that we are not going to receive or accept payroll from the MOH unless it is accompanied by the requisite resources to pay these workers at the market rate. Because our urgent need at the moment is to confirm how many workers we have. Because as it were, at the moment you've realized there are discrepancies, whether it's 3,000 or 2. It is not right that you can lose even resources of 20 or 30 employees using taxpayers' money if they're not working, leave alone 3,000. So the issue of the figure really does not matter unless you're telling me, Yvonne, it's okay to lose taxpayers' money on 20, or you're saying 200 is okay, you know? So we have said, if we do not have the requisite resources that are going to accompany the payroll, then we will not be accepting the payroll. And that is why we agreed that there are other ways of doing the headcount. Let us do a joint headcount.
Yes.
And the only way we can be able to do that joint headcount is if we have the payroll. The payroll can be available without being transferred. We can get a copy. I need a copy to tell me that in Tharaka Nithi I paid 230 or 223 workers, and these are their names, and this is their cadre. Then I'll be able to tell you, no, I do not have 223, I only have 180, or one decent number. So where are the other 30?
But
where are
Governor,
the other 20?
Governor, hasn't that process already began, at least even in the letter that was signed by P.S. Soluka here? Because he said he got those figures that you're saying in terms of having a conversation between Ministry of Health and the Council of Governors to say, what are your numbers and what are ours? And he says he got those numbers from the Council of Governors.
We cannot be talking about numbers that are differing. If the numbers are differing, then we have to do a head count.
Yes.
That is very critical.
Yes, but just to establish that those discrepancies have already been established, right?
If they
based on this letter.
Yes, and now we need to do a head count to ensure to affirm this, because if the numbers for the ministry and the ones for Council of Governors were the same, there will be no need of doing a head count.
Okay.
At the moment, there are discrepancies, and we need to ensure that what we are dealing with is the same.
All right.
Secondly, on the issue of absorption of permanent or pensionable,
yes,
which the ministry is not committing at the moment, we do not want that problem to transfer to us without being addressed. Yes, there's need for us to have the supervising body being the one to pay the salaries or the remunerations, but we would like that to happen if the resources and the terms have already been rectified. Why does the ministry want to transfer the problem to the counties when these workers are already on strike, yet you've been sitting with them for the last 5 years?
P.S.?
I think the answer to that is very simple, is that myself and the Cabinet Secretary, we are just a month old, and we cannot break the law. Resources must follow function. That is the constitutional mandate. So the fact that it hasn't been done before doesn't mean that it shouldn't be done. I think that is not really to absolve ourselves from this responsibility, because even the transfer of that resources will be based on either additional revenue, which goes, I think Governor is aware of that process. So it will still be in the budget of the Ministry of Health. So it will still be our responsibility to look for those additional resources and then transfer them to the county governments.
Do you both hear what the workers are saying, which is, fine, you want to move the payroll and completely devolve us. Okay. But can we sort out these issues that we have? For instance, we want assurances that we will be on permanent and pensionable. When the contracts end, we want the assurances of gratuity and other promises that have been made. Being constitutional and being right, that's one thing. Yeah, so but do you understand the fears that they have about transferring them without sorting out their issues?
My submission to my budget submissions before the Departmental Committee of Health at the National Assembly, which is on the Hansard, you will get it very clearly, the appeal to the National Assembly to appropriate additional resources.
Okay, what would those resources look like if you were to now sort out? Let's try and understand this. So when the contracts come to an end in May 2026. The gratuity, the putting them on permanent and pensionable. Just help me understand what that looks like in terms of money, because the government has said we don't have money, but what would the PNP look like in terms of
So the annual budget for the permanent and pensionable would be around 7.5 billion. The budget for the gratuity would be around 5 billion. And we have already done all the tabulations. Yvonne, we are extremely organized where I work. And these figures have even been submitted. They are on the Hansard. So the fact that the resources are not available doesn't mean that we haven't requested for them and that we haven't done the processes that are required of us. So we can only wait for other government bodies to also give direction, because I think this is a whole collective responsibility. And I think it is important that we state that this is a problem that has been there for 5 years. We have just started working on it in the last 1 month. And I think the workers are also, in a way, being unfair to us, and I think it's perhaps because of the goodwill that we have, and maybe they are also seeing that movement, the fact that we are also taking action. The first day my cabinet secretary was in office, he is the first cabinet secretary to walk to the gate to address the workers, and he promised that he will take action within 3 weeks. And we started taking that action. We did the tabulation. We met with the Council of Governors. We have done the letters that now you are seeing that have even unearthed the discrepancies. We have already agreed on the issues around audit. All of these are meant to bring a decision.
Okay.
Because all of these were not happening before.
Okay, let's take another question now and see if we can address that. Kindly ask PS to look at this. Last year's supplementary budget and money for UHC transition was factored in. The ministry, however, transitioned only 100 UHC staff working in national facilities. Where did the remaining money go to? Why did they only transition a few while the money was available to transition all of us?
So I think there were 104 workers, and they were not transitioned. I think that is, this was a different recruitment process within the national government facilities. For example, you ask the National Treasury, and this I'm answering based on the records that I have perused. because we don't bear responsibility in terms of that work. But based on the records that are there, is that there were advertisements in the national government facilities, and these workers applied. And when they were applied, they got the job. We have had the same in 7 counties that I've mentioned. I've mentioned Kakamega, that have also written to us and said 4 of our workers have since gotten jobs by applying for the vacancies. We've gotten the same from some of the counties like Kirinyaga, some of the counties like Marsabit, that have also mentioned to us, we had this UHC number, 13 of them have since applied for the job and gotten. And I think it is important, and really thank you for inviting us, because we need platforms to clarify these issues so that there is the misconception and really the misinformation that there is perpetuating discrimination. I think that should, we need to let the workers get that off their minds, because I think they are truly hurting, and some of this misinformation is hurting them even more.
Sure.
I think the reality is that there were vacancies in the national referral facilities. These workers applied for those positions. They were recruited by the boards. These institutions have boards. They are not recruited by the Ministry of Health. So you go for an interview by the board, and then you are recruited, and therefore you relinquish your contract with the UHC. So that shouldn't be interpreted as transitioning others and leaving out others.
Okay. What is the way forward now? What happens? I know we've said a lot, and there's many more questions, and we'll try and tackle them. But I want to start understanding what happens tomorrow, what happens at the end of this month, and what are some of the critical steps, because the workers are saying they're going to remain out on the streets and continue to protest and make sure that they get that. What are some of the assurances that both the national government and the county government can give to the workers today in the course of this transition? Perhaps, Governor, I'll start with you.
Yeah, I want to appreciate what the PS Oluga said, that there's goodwill to be able to look for these funds, to be able to make sure that we sort out both issues of gratuity, permanent and pensionable, and of course the current issue of headcount, which may not necessarily be needing resources, just needs our concerted effort. However, it is important to note that we do not have any arrangement with the Ministry of Health outside the law to engage in terms of transfer of resources. There are only 2 ways that money can be able to get to counties in a way that it is going to benefit the workers. One is what we call county government's additional allocation funds that are usually appropriated in Parliament through that act. 2, it can only be through DORA, which is the usual equitable share. And unless these monies are reflected in these 2 funds, then this other one of we are doing, we shall do, will just remain nothing else but a promise. So we would like to see, from where we sit as a Council of Governors, this money being factored in either the DORA or in county government's additional allocation, so that it is clearly stipulated there, the way we usually have the one for the CHPs, that this is the amount of money that has been given to the counties as a county additional allocation to pay the CHPs. Okay. That is the same we would like to see. These are resources that are being put in place through the normal appropriation to be able to pay the UHC workers.
All right.
Otherwise, the ministry will just be transferring the solution, the problem to us without a requisite solution. Are you,
very quickly, are you agreed with the PS in terms of the amounts that would be needed to, in terms of PNP, permanent and pensionable, 7.5 billion and 5 billion shillings that would be needed for gratuity? Is that a figure that both of you agree on from your perspective?
Absolutely. If they gave us 12.5 billion in the equitable share or in a county additional allocation, we will be comfortable absorbing these workers as permanent and pensionable and continue providing services as we pay them.
All right, let's take another question now. And this one, I think actually will be for both of you. Our payslips are always from the Ministry of Health. If tutakuwa transferred to county, who will pay us our gratuity and when will they do it? And why are they in a rush to transfer our payroll to counties instead of solving our issues first? I think perhaps, Governor, I'll give you an opportunity to answer the first one regarding who will pay that and when. Governor? If
the payroll is transferred to us with the prerequisite funds, including the gratuity, we shall pay. But if the ministry will retain the payroll after our headcount and maintain the payroll for the next 1 year, then we would like them to transfer to us at the end of the contract period workers that do not have gratuity to be paid, but with the prerequisite funds to pay the market rate salaries going forward.
Okay. Question. Will this take until May 2026 to sort out? PS?
Yes.
So you're going to wait until the contracts lapse, or is there a possibility that these talks could sort out this matter? You end the contracts before May 20. I mean, what's the plan? Just so that
the plan is extremely elaborate. In just 1 month, I've told you the amount, the volume of work that we've done around this issue, and around really many other issues. I would have really loved to talk about the volume of work that we've done around vaccines, around SHA, around issues around family planning, the work that we've done with other workers. But I think this is also a significant issue, and so I will heal my. I will cool my heels and just discuss this issue alone. Yeah. But basically, the work continues because what we have mentioned is the engagements that are needed to correct a 5-year problem. A 5-year problem, really. And so we have initiated the process. We're engaging with the National Assembly, we're engaging with the Treasury, we're engaging with the workers, we're engaging with the core partner really is the county governments, where the rubber meets the road. It's really the county government. So you know, we are working together in the spirit of one government to make sure that this issue is sorted out. But as I mentioned to you, the contracts, when they are extended, they are still alive contracts. They are not contracts that have ended. And so the discussion goes on until May 2026. When we can now discuss the issues around gratuity. If they're at the end, let me mention something that some of those discussions have started. I don't want to make the suggestions around the table, but you know, gratuity is also usually more like a handshake, like thank you for the work that you've done. Yeah. Please take this and see you later. When we are also going to discuss the issues around now converting those contracts to permanent and pensionable, and the Public Service Commission and the County Public Service Boards will guide, then that means that the contract has been varied. That means it has not ended. So again, we will have a discussion around the gratuity. And I hope I am not...
yes. My specific question, Daktari, was on whether, just to understand the length of time that we will spend on this negotiation process, my question was, Daktari, is do you plan to have this concluded in May 2026 when these contracts will expire, or is there a plan?
No, there's going to be a lot of goodwill, and I mentioned there's a lot of goodwill. Yeah. And the way that we're engaging, the Council of Governors is engaging with the Cabinet Secretary. And from those discussions, so I think there may be a solution soon. I think. So
allow me to finish the question, because this was the question. If you are able to finish this before May 2026, we're currently...
We will implement it.
Okay, let me finish the question. We're currently in the budget-making cycle, right? In fact, the budget will be read next week. What would that mean in terms of allocations, which was going to be my question? Have there been any that have been done any requests that have been done or any budgeting that has been done in the budget that we will see presented next week, or will you then look to a supplementary budget? That was my question.
I'll repeat, Yvonne. We made a request in the submission, and my own submission on behalf of the State Department for Medical Services is in the Hansard. Anyone can go there and see and hear and read what we submitted, and you can confirm whether we indeed submitted the issue about UHC. So yes, we did our submissions. But the outcome of our submissions is also based on a lot of engagements and considerations by the National Assembly and by the other priorities of government. And so unless you have a preview of what the budget that will be read looks like, I particularly cannot confirm for you whether our submissions have been considered or not considered. So as at now, we work with what we have in our budget.
All right.
Let me help you there.
Yes.
The budget that will be read next week, it is usually not cast on stone, because it may not be possible for government to have all the resources at once. And in fact, we are talking about resources that will be required in 2026. What we need is a commitment and a plan that this will happen, because it is possible later to have a supplementary budget to be able to take care of some aspects. So we need concerted efforts between the ministry, the Council of Governors, and the workers to have a roadmap towards ensuring that by 2026, June, we have resources to action these workers being turned to permanent and pensionable. As to the issue of the gratuity, that will be between them and the employer, which will be worked out that time. So the moment what is making these UHC workers be out there is lack of confidence and trust that this will happen.
And that is an issue that both of you have to deal with, including trust in the working of the county government.
Well,
what assurances
I'm not sure about whether we have any trust issues, because all UHC workers, the majority of them work in county governments at the moment.
But they still don't trust that they will get their pay in time if they are transitioned to the county government.
That's a serious issue.
I mean, Governor, if it's a trust issue, it's a trust issue.
There's a serious issue because I said we have one government approach, and county government does not get resources from outside this country. We are all in one basket called the Treasury, and therefore there is no day that resources will be released by the Treasury to the counties to pay workers and the counties will not pay. So it is the same thing. One basket, one government approach. There could be another reason why UHC workers will not want to be transitioned to counties, which is best known to them.
What do you think?
I think they just like the gap that they can be paid from the Minister of Health, and the Minister of Health does not account, or rather they don't account for their time to the ministry. So it's a question of...
So you're saying the UHC workers are not accountable or don't want to be accountable?
Well, I'm not saying that they are not going to be, they don't want to be accountable. I'm just saying for the same reason, I'm just trying to think, what reason would they have not to want their payrolls in the counties? Yet that's where they work. How can they say that we have trust issues where they have worked for the last 5 years? All right? So if they want to go and work for the national government, then they should be asking the national government to transfer them to the national government facilities, so that now the counties can be able to recruit afresh for those who trust to work for them. Otherwise, it's not a question of trust, because that's where they work. Categorically, it's not. But bottom line, we need to work on a solution in the next few days, because the UHC that we are trying to work so hard for, if we do not want to let down the government of Kenya Kwanza and the vision of the president of this country, we have to make sure that UHC is supported by having the most important resource, which is the human resource, which drives all the others. You know, we can talk about vaccines, we can talk about the equipment, if we don't have a human resource that is driving this, then the UHC is not going to succeed. Okay. So it is an urgent matter that needs an urgent solution to the problem.
And indeed, we will hopefully have the opportunity to have you on to discuss all those other issues. But for now, this is the primary issue of concern. And like you say, having workers is what is most important. Do we have one last question? I think we can, yes, take a look at that and then just wrap this up. Let's take a look at the question that is in. All right, there we are. I'm a UHC staff. Our colleagues working in the national facilities were confirmed. Is this the one? No, we've already answered this one.
That one.
We've answered this one. So let's, there's like hundreds of them. Do we have another one that we can put up on the screen?
Yeah, and Yvonne, let me just mention as we answer that one. Yes. I think we have been extremely deliberate also in the Ministry of Health to engage, and we are very keen on restoring the trust and the confidence. We are very keen on efficiency in our implementation of UHC policy priorities, and also in establishing order. And one of those things that we are doing is really to engage, because we've found out that there's a huge information gap, and we are engaging with these workers. That's why you saw the Cabinet Secretary went to meet with them. We've been meeting with them. We are still available to meet with them, because we also want this evidence. But where there is no evidence that national government workers were absorbed, and we are telling you that this is the process, they applied to this board, they did that interview, and they got that job, and this is a different contract, I think it is also good for the workers to have some understanding, even as we collectively work together. We want to have an environment that is extremely transparent, that the only currency of trust is truth, that we engage compassionately, but also we are compelled by the evidence that we have in terms of our decision making. So we as much as we want to really empathize with the plight of the workers, we assure them that we are working on these issues, but we also want an environment where there is some truth in what has happened. So I don't think that that the workers should be so concerned as to let me use the word perpetuate information that is not true.
Yeah. Okay.
And Yvonne, is also it's very critical that even the UHC workers realize that there's a law in place.
Yeah.
They are clamoring to be confirmed as P&P now. It is not possible to change a contract midway and make them permanent and pensionable. It can only happen at the end of the contract, because there's
or you can break the contract.
Or if they break the contract, that is another process.
Yeah.
So it is important for them to know whatever we're discussing will happen at the end of the contract, which is next year in May.
All right. So these letters that we're seeing on the 2nd of April, 2024, from the Office of the PS, talking about transition of staff under the UHC program, granting approval for renewal of appointment on local agreement terms for the 8,571 that, Governor, you were speaking to for a further period of 1 year. The PSC being requested to approve absorption of the UHC staff into permanent and pensionable terms by the respective county public service boards. This is what they're saying. These were agreements that were made in 2024, and it's now 2025. That the National Treasury make provision to bridge the gap in financing that transition. That the PSC to consider any of the following options with respect to permanent payment, of service gratuity.
The contracts were extended, Yvonne.
So they were not given, the contracts didn't lapse, and then you started a new contracting process?
The contracts were extended.
Okay.
Yeah.
Okay. All right. I guess we'll have to leave it at that for now, hoping that there will be a quick resolution to this matter. I think, like we've said, lots of work is being done, under the ministry with perhaps better medical equipment, vaccines, but it all boils down to these workers.
Really.
Without the workers, we wouldn't have a functioning healthcare system. And so hopefully these issues are resolved quickly and to the satisfaction of all involved. 96 days and counting is a very long time. In fact, Governor Oluga, PS Oluga, I might remember that while you were at the KMPDU, your strike was about 100 days. So we're sort of nearing that now with this one, back in 2017. Hopefully this is resolved in a more amicable manner now that you're on the other side of the coin. All right, that's where we leave it at for now. Thank you.
We got a new CEO at SHA.
You did, yes. Dr. Mercy Mwangangi.
Mercy Mwangangi.
Yes, all right.
With extensive reputation and expertise, and we are very upbeat.
And lots of expectation.
And lots of expectation.
For both of you
and we are working day and night.
Okay.
Yeah, there's no sleep. We are working day and night. And I think Kenyans are feeling it. I think you can get the atmosphere once we sort out this issue of the UHC.
Right. We really have to close, Dr. We really have to close. Dr. Uma Oluga, who is the PS for Medical Services, and Muthomi Njuki, who is the Governor for Tharaka Nithi, also the Chair of the Health Committee in the Council of Governors, on the stalemate, where it goes from here, a head count in the second week of June, and hopefully some resolution to the issues that are being raised by the healthcare workers. That's the Explainer. Let's take a break. We'll come back with more news.